Hello and welcome to SimCast, the higher education simulation podcast. My name's Lawrence Hill and I chair the simulation group in the School of Health Sciences at UEA Norwich.
Hello everyone, my name's Tony Jeremy and I'm the academic lead for simulation-based education at UEA Norwich.
Today we are joined by Carolyn Cleveland, founder of C&C Empathy Training Ltd and the creator of the Empathy Navigation Pathway. Carolyn is an approved training provider under the national framework and part of the Civility Saves Lives team. Carolyn, a very warm welcome.
Thank you, both of you. It's a real pleasure to be here and thank you for inviting me. I'm very excited to do this podcast with you.
Great. And today we're going to be talking about empathy in simulation-based education and what we can do to help create compassionate as well as competent practitioners.
If you enjoyed the episode, please give us a like. Equally so, if you didn't like the episode, give us a dislike, but let us know in the comments why, because we're always keen to improve. To keep up to date with all things Sim, subscribe to the channel and don't forget to check the notification bell. And SimCast is available on all popular streaming platforms.
So, Carolyn, it's so great to have you here. We met, didn't we, back in 2024 at the Anaesthesia
Associates Conference. And we were opportunistic a little bit, weren't we? You were a speaker there, and we were kind of reviewing the conference and seeing if we could speak to speakers if we could. Yeah. And we got you on, and we made a pledge to get you back on.
Yeah,
because we just didn't have enough time.
No, we had such a good chat, and you were telling us then that you've got a background in psychology and counselling, specialising in loss, fear, and vulnerability, and you founded this company, C&C Empathy Training Ltd. And devised this empathy navigation pathway after having to navigate the system yourself. And when we talked, you said a bit about how you've developed your work and your business because of the real human impact of failures in compassionate communication, failures in patient safety, failures in complaints and inquest systems, and that this is the sort of guiding why behind everything that you do. But people that are listening will have no idea what that is. So would you mind telling us just a little bit about why you do what you do? Yeah,
absolutely. And actually, I kind of need to take you back a little bit further than that because I sit here at the grand age of almost 56 now. And I'm going to take you right back to when I was 22 because that's kind of really where it all started and where I didn't realise at the time, but was actually using my own empathy navigation pathway. And it started off when I very sadly lost a good friend from a misdiagnosed cancer diagnosis or a missed cancer diagnosis. And she left the care of her 4-year-old daughter, Sophie, in part in my hands. And at 22, I was floundering around, it's fair to say. But I had
That's an enormous thing at 22 years old.
It was an enormous thing.
I'm pretty sure I couldn't tie my shoelaces at 22.
Well, as I say in my own podcast, I was still setting off the smoke alarm, cooking dinners, and suddenly I'm answering questions from this 4-year-old that I wasn't prepared for, but also having to find my own path in my own life with it. And I wasn't consciously aware of it at the time, but what I was doing was very much recognising what I couldn't do in that situation because I couldn't change any of the facts for her. But I also realised there were things I could do in that situation. I could try to imagine what she was going through. Her as a 4-year-old, not me as a 22-year-old. Of course, they're going to be very different experiences. I had to feel some of those emotions the best that I could, and I had to try and recognise what compassionate action I could take, despite there being things I couldn't take. Excuse me. And of course, some of those compassionate actions were simply listening to her, were doing practical things that mums do, picking her up from school, things like that, and just holding her emotions. And so I continued to do that for the next 11 years of her life, and that gave me a real interest in counselling, in psychology, where we sit when we're in a position of fear or vulnerability, and how we operate in a very different way when we're in those places, and what happens to our well-being, what happens to our resilience. And then very sadly, when Sophie was 15, and we'd put a lot of this grief behind us, She very sadly died in what was a patient safety incident. And I suddenly was up against quite a brutal system at that time. And you can see it resonating still today, even though it's, there's been lots of improvements. But I was met with a system that didn't make empathy evident. It didn't make compassion evident. And actually utilised the fact that I hadn't given birth to her and wasn't her biological mum as a way to silence me. And so actually I had to fight for the fabric of our relationship just to be heard. And it, I think, kind of just re-sparked the need for some real world understanding of not being perfect, not getting it right all the time, but the messiness of life. And how sometimes there are things we can't do, but there are definitely things we can do. And how do we engage that interest with people to do it? And that's kind of my why.
And I can completely see why that would be. I think, the thought of losing her after 11 years of being in your care, and you sort of just mention it, and it's become part of the fabric of who you are and why you do what you do. But it just to hear you say it again, even though I knew what you were going to say, just gives me
it's so
chills.
Powerful, isn't it? So
to think, when you were at that stage at 22, no one's prefrontal cortex is fully developed at that stage. So this is clearly like a hugely important part of your life, and has led to you encouraging, engaging people and educating people about how to introduce compassion and empathy into what they do.
So do you think this would have always been the way for you in terms of developing your understanding and around empathy? Or was there ever a point where you were like, I don't know if I can do this?
Oh, I think we all have points when we think, I don't know if I can do this. I think I still, in my 50s, have times with things in my life that I think, I don't know if I can do this. Whether I would have done it the way that I do it, I can't answer that. But I think it's very much, it was a very strong instinct in me. So it was very much how my brain was looking at the world anyway, my outlook, obviously from the narrative I'd had throughout my upbringing of how I saw the world. And I think it just, with having the counselling training and the psychology training, it all kind of then fed in together. So as I was studying academic information, it was being made sense of in my brain, with lots of real world messy experiences that I was then...
So many parallels there.
So many parallels.
Yeah, it kind of made me navigate it in a certain way. And that's, I guess, in essence, what I try to do now, that we can understand in one way, but to kind of really get that wisdom around it, we have to look at so many different variables within us and externally as well.
And that's, I think, where... the kind of the main kind of focus of what we're going to talk about today, about, compassion and empathy in the function of in simulation-based education really starts to come into focus. And something you mentioned, the 22-year-old Carolyn, who was not consciously aware of, in your words, of how you were navigating this empathy process is something that we as healthcare educators need to make learners aware of their capacity for empathy and compassion. Yeah.
I've got so many questions.
Yeah.
Can I just ask a little bit about your story? So
absolutely.
You mentioned how you were met with a system which lacked empathy.
Yeah.
Was it the system? What about the individuals and the people that you had to deal with? Because I think we're at a time where, again, in healthcare, the people working in that environment are pushed to the absolute limit. Of course, you often see... what happens when people are stress test?
Yeah. I think it's a combination of those things. I think the system was very rigid. I don't think the system empowered people to recognise and develop and utilise their empathy, their compassion. I think in some respects it did the complete opposite. And people were succeeding if they were silencing me, if it wasn't a psychologically safe environment, then that was okay, rather than now we're recognizing the damage that does. We didn't hear about psychological safety. We didn't hear about incivility in the same way back in, we're talking about 2003 now. And so I think people's resilience, people's fears, people's own discomfort was hidden within these systems. So if somebody was feeling uncomfortable, if somebody was not able to expand their viewpoint and see me, for example, as being in hospital with Sophie, but my circumstances with Sophie as a mum was not the norm either. I'd come into being her mum for very different reasons. If somebody wasn't able to do that
the system
themselves,
sort of brought them out.
Yeah. It kind of enabled that more damaging communication to prevail, rather than actually supporting somebody to see something differently.
And so a lot of your work, and we're going to come to talk about your business later in this podcast, and what we'd like to try and focus on in today is going to be around how empathy and compassion training can be kind of thought about from a learner's perspective, from an educator's perspective, before coming back to talking about your business and how you do what you do. But one of the things that you've developed since we first met was the empathy navigation pathway infographic. And we might refer to that a couple of times. So I think if we can hopefully bring that up and show for those people that are watching on YouTube, we can show a bit of that hopefully. But it's can you tell us a bit about it?
So talk us through it from an audio point of view for people who are listening as well.
Yeah, absolutely. I did this, even though I've been utilising it within my training for the last 10 years, I decided to put it into more of a structured infographic, because it suddenly dawned on me people are, within my training, whether it's a conference or whether it's a full day's training, they're taking on a lot of emotional information, a lot of academic information. They're dealing with a lot of their own thought processes, their own emotions, their own trigger points. And if somebody actually asked me one thing that they would actually take away from that, and I thought, gosh, even though I know my training inside out, would there be a very simple thing if that's all they had the ability to take away?
Yep.
And I thought, actually, yes, there is. There is that pathway that I used, even though I didn't call it that, obviously, at the time. But the really important part of that I have a 4-point step. So I have the first step, which of course is imagining and intellectually understanding somebody else's experience. The second step, having that emotional understanding where we can use our emotional empathy, we can connect with somebody's emotions. But often what's missing is that recognising what we can't do. Yes. And so that's the third step. What can't you do in this situation? This is using our intellect in a different way. It's using our logic. It's recognising the reality of the situation, our limitations. We can't change somebody's life events. We would love to be able to do that, but we can't sometimes, and that can feel like a heavy burden and affect our well-being and affect our resilience. When our well-being is affected, it narrows those pathways in our brain to see perspectives. We go into cognitive overload, so it makes the whole process more difficult. We can't suddenly create more resources or a bigger workforce and be less busy in our day-to-day jobs. We may have internal limitations where we are feeling overwhelmed, or maybe we are fearful in a situation, and there's reasons why we can't take certain steps. And so I think it's really important for long-term empathy and compassion that we allow that understanding and self-compassion for us. So that's a really important part of the model, if you like, that often isn't within empathy training. But let's not get stuck there. Let's then look at number 4. And number 4, of course, is that compassionate action. What can we do? And that can be done thing may simply just be listening to somebody. It may just be trying to understand their perspective and communicating that to them. It may be practical things that we can do. And so it's trying to, in a very visual, very simplistic way, really, taking them through 4 simple steps where they recognise empathy, They recognise what they can't do for their own well-being, for their own self-compassion, but they finish off with, but what can I do?
So
what can I do?
Was that very deliberate to have step 3 before step 4? And I don't mean it obviously in numerical order, but what you can't do and then what you can do.
I think it is, and I think it's something that I very much drew on because I couldn't get to what I could do for Sophie until I recognised what I couldn't do. And when I was focused on what I couldn't do, well, I can't change the fact that she's lost her natural mum. I can't take away all of that for her. And I could have stayed with that and felt completely debilitated. But hold on a minute. That aside, is there anything I can do in this situation? And I can stop grief from overshadowing her life. Not totally, but there'll be things that I can do. You know, I can be present for her feelings and not dismissive. So to me, in enabling ourselves to recognise those things that might block us and staying stuck there, let's acknowledge them, let's recognise them, but then let's move forward to what we can do. And that's that compassionate action.
And
part.
it's you know, the way you describe it, it's abundantly clear how that may help people to navigate difficult circumstances. And as educators, I think, you know, instilling these principles into learners would be really effective. But I also see it as well as being a tool for simulation educators to think about their own practice. Because, you know, there are things that you cannot help. For example, what a learner's pre-existing knowledge is if you put them through a simulation event and it's their knowledge that's stopping them from engaging. But you can focus on what you can do. You can understand their position and walk through those steps. And that's why, you know, we'd like to get you in to come and speak to some of our simulation educators and to try and see how they can use what you've developed as a tool for helping them become better educators. So that's part of the plan. But bringing the focus into the learner at the moment, like empathy is a term which is used a lot. It's kind of bandied around, and to be honest, I've probably included it in simulation-based education learning outcomes in the past. But what are your thoughts on the way, speaking from your experience of engaging with the healthcare system, what are your thoughts on the way that empathy is taught to healthcare professionals?
I think there's so much good work going on around empathy and compassion and supporting people to utilise their empathy and compassion. I think there is still an awful lot missing on that being done in a way that is also empathising and being compassionate to the learner. And I think there's a real danger of when somebody's feeling that what they're doing is not enough and they've just got to lift up the ante all the time, there's a danger that people will shut down and will close off because they are feeling overwhelmed with things going on. Particularly, you know, if you're learning new information and you're doing that a huge amount of time, that's exhausting in itself. And when you're then taking it into the field where you've got to look at an emotional landscape of not just one person, but every single person you're dealing with, you're working with, and your own, that's a massive thing. And I remember when I was just speaking at conferences but hadn't developed my full training programs, I would sit there at conferences and just think, you're just telling people they've just got to do better all the time. And I would feel exhausted listening to it. And I'm thinking, you're not actually helping them understand why this is important, but where the barriers might exist within them and within the systems that they're working within. In that messy reality. And yes, there's, you know, I say right at the beginning of my training, you know, I'd love to give them a magic list of words and phrases. Can't do it. Best place for that's Google or now ChatGPT. Will give you amazing words, amazing phrases. The trouble is when we're under stress or we're dealing with somebody else under stress, that breaks down. And I don't stand in front of people having got it sorted all the time, because there are times I will struggle to empathise as well as I'm capable of doing, or to feel compassion or to show compassion, because I'll probably shut down for my own self-protection at some point. And so we need to recognise all those variables, but keep people engaged with the desire to want to do this, because they really recognise the difference that it makes to other people, to them. And that's, I think, what's really important. But we can't do anything about the barriers if we don't recognise that they're there in the first place.
Sure. And there are, aren't there? There is superficial empathy at times, which is probably that kind of empathy that gets used.
I know the right words to say, so I'm going to say them.
Yeah.
It's almost like a polite performance.
Yes.
It can become, and it
I can
loses
tell this
a
is a
little.
very distressing time for you.
Yeah.
But the thing is, when you're on the receiving end, you know when someone is genuinely showing empathy, don't you? And you can also just see when they're trying to pull the wool over your eyes.
You can feel it when it's embodied. So what is it, do you think, that is the difference between that superficial empathy and the embodied empathy?
And a follow-on question, has everyone got the capacity to do it?
Okay, hold on to the follow-up question, because one of my downsides is I can't answer multiple questions.
That was unfair of me.
I've already forgotten the first question. So remind me of the first question, and then remind me of the second one.
Yeah. So what do you think is the difference between that superficial empathy and the true embodied empathy that we can feel when we receive it?
I think using the word that you've just used, feel. So from the person receiving that empathic communication, it has to be felt. And I think to be felt, it has to have a level of authenticity to it. And so from the person providing that communication, if they're saying all the right words in the best way, in the best tone that they can, really not that interested, they're really not that bothered, it will come across in a certain way. The person receiving it might not realise what's missing, but we realise what's missing. We know we're reading signals in so many different ways, and we can all recognise it. Something just feels a bit off, doesn't it? Or just doesn't feel quite genuine, even though all the words are word perfect. And so it is recognising that it has to come from that desire to care about how somebody else is going to be feeling. So if I'm working with somebody about writing letters, responding to complaints, it's about recognising there will be factual information that you're needing to respond to that might be the difference between something being done correctly or not correctly, if it's to do with a healthcare complaint, for example. But there will be lots of emotional information, lots of emotional component within that letter about how somebody has felt in that. And if you're not recognising that and you're not responding to that and you don't care about that, you're much more likely, not always, but much more likely to come across in a way that's not authentic.
Or if you're working in a system which has a time constraint, for example, in so many areas in healthcare, and you're just seen as another cog in the machine.
Yeah.
That's, I guess, what you were going back to earlier about how the system set people up to fail, even if they wanted to show genuine empathy.
Yeah, absolutely. If you're not given the time, and that's a reality of life, isn't it? But if you're not given the time, it's going to impact on how you communicate, even within our personal lives. It's as a mum, mine have all grown now, but as a mum, I'm much more empathic and compassionate the first time I've asked them to put their shoes on when we've got 2 hours to get the door than I am at 10 to 9 when I've asked them for 10 times. And they're still the same children and I still love them the same. But my tone is going to be very, very different because I'm really not feeling it at that point. I'm really feeling...
So I'm going to jump back to my follow-up question.
Yeah.
So my follow-up question was, do you think everyone has the capacity to be empathetic? But also... we are big believers in concrete experiences. Yeah. And there's definitely got to be a little bit of, if you take your story, for example, and I know it's kind of an extreme end of a spectrum, you've had to deal with these huge life events, and undoubtedly you've developed some of your empathy from that. What do you do with someone who, let's take an example of an undergraduate learner, fresh out of school, no experience? How do you develop those really deep skills in terms of dealing with empathy?
So the first part of the question, thanks for asking two more at the same time. Again, I'm going to really try to remember. But the first part, so research says that 98% of us are hardwired to be empathic. That doesn't mean that 98% of us are utilising it, but we have that capacity. And within that other 2%, you're then falling into the more psychopathic, sociopathic sort of spectrum there. But most of us, 98%, will have that capacity. That doesn't mean we're processing things in the same way. So with neurodiversity, we'll be processing things in the same way. So I've got twin boys, they're both autistic, and how I understand empathic communication and communicate it won't necessarily be recognised as empathic and compassionate communication by them, and vice versa. And that's called double empathy effect. You haven't got that same capacity to understand, to process all of these things. And that's our biology, and there's nothing we can do about that, but we can develop ourselves. You know all of this already. We can change the structure of how our brain is working, but you do have to want to do that, because otherwise you don't put the work in, you don't change how your brain is working. So I think there has to be an element of wanting and an element of desire. I don't think you can ever force anybody to do it terribly easily.
Something you mentioned a couple of times, and I suppose as a simulation educator, I'm wondering whether we can use simulation to train empathy, right? Because you've talked about these embodied real world experiences, whether it's asking your kids to put their shoes on, or whether it's the experience you described with Sophie, or whether it's some other kind of real world engagement. The challenge that we have is that we put learners into an alternative reality when they enter into a simulation. We strive for authenticity,
but we never achieve it.
But we never achieve that full kind of real world embodiedness. And I wonder whether that's just one of the limitations of simulation-based education we need to think about.
Well, what we do then is we apply Carolyn's infographic and we look at stage 3. What can't we do? Well, we can't provide these completely genuine, authentic experiences. But what can we do? We provide an environment where we can give them the tools, and then maybe through debrief, tap into potential concrete experiences that individuals have had. And, we've talked about this several times, is sometimes the simulation, and we mentioned this before we started recording, the simulation is just sort of a vehicle to engage a much deeper conversation based around people's lived and concrete experiences.
And I think when people can, which we did touch on earlier, didn't we? When people can actually start to take information, put some element of emotional understanding to it, and then they can actually associate it with some of their own experiences. And it can be a completely different experience, but some of the similar common themes of emotions, that's when we stand the best chance. I talk about something called our emotional library, because we'll all have very different experiences, and I have a picture of a library on the screen when I'm doing it. Yeah. And Joe, this is how I see our brains, as strange as that may sound. But every experience we have, if we think of that as a book that goes into our emotional library, but I will have different books in my emotional library that you will have in yours, and Lawrence, and you'll have different books in your emotional library that you will have in yours, because we've all got our own different, unique experiences. they'll all have common themes.
Right, we're all going to have an anger section. We're all going to have a frustration section.
Absolutely. So I talk about the loss of Sophie. I may have somebody in the group who has experienced the loss of a child. It will still be different to mine, but I might have and have had in the past. I may have somebody who's at the stage where they haven't had any kind of significant loss, but they will still have an element of fear of that loss. They will still recognise a loss, even if it's not a death, a loss in a different way. You know, we can have losses when we're losing, you know, if there's a marital breakdown, we can have losses when we're moving homes even. For a teenager, moving house will be a loss potentially of school friends and school environment, their bedroom that they've been in since day one, into a whole different area. So we will have common themes. We will all know the feeling of happiness, of joy, of sadness, of frustration. And so I talk about tapping into that emotion. If you're somebody that doesn't suffer from anxiety and you're talking to somebody who is anxious, there will be a time you will have felt more anxious than another at an exam, doing a driving test. What did that feel like to not know exactly how somebody else is feeling, but what things might come up for them, what actions might be supportive to? Does that make sense?
Yeah, it makes perfect
Absolutely,
sense.
mate. So what you're essentially kind of proposing, I think, is that as simulation educators, we have to encourage our learner group to borrow from their emotional library in order to understand something in a way that's deeply connected to their own personal experience, as a way of using the artificial experience we give them to feel real and connected with the human life world.
Yeah, absolutely. To recognise our common humanity, and whilst we will all experience things very, very differently, we all recognise when we've been heard, when we've been understood, when we've been ignored, when we've been treated unfairly. We'll all recognise a level of injustice, of support, of love. We recognise these things, but they're all wrapped up very differently for each of us.
So what we're essentially discussing though here is any really quite incredibly sophisticated piece of communication taking place between a facilitator and a learner group, and psychology. And you know, simulation is known to be a complex social endeavor, but I don't think the depth of that complexity is kind of realized until we're talking about how experiences affect us as individuals. And that's why I think we really wanted to focus in this podcast about the role of, you know, empathy and compassion training for simulation educators, because what we're describing here is asking facilitators to tap into deeply personal experiences which you as an experienced and qualified counsellor are equipped to do. So, you know, how can we prepare educators, I guess, for these conversations which will necessarily be very challenging?
And going back to what you said right at the beginning, when people come onto your course and they're like, I could take only one bit away. You know, we do a whole course on just the educational theory behind simulation, let alone delivering genuine empathy with it as well. There's only so much that an educator can. Yeah.
So what do you think we need to do to prepare educators?
I think, again, recognising what you can't do. As my work, if I was doing counselling, what I would be doing with an individual is very different, very, very different to what I would be doing in a room full of learners, for example, because I can hold their feelings in the room to a certain degree. I personally do follow-up emails to give people the chance, because I know that there's going to be things that are raised for people that they may not even feel comfortable talking about in their group, let alone if, you know, that they're feeling that they're with peers that they're going to be working with the next day. They might not want to raise it. So I have a responsibility there. But of course, this is my complete day job and what I do. But there are times I think, gosh, I'd like to be sat with that person and seeing them next week and the week after and the week after, because I can recognise potential things that this person is carrying that I'm not in the position to be able to deal with, but I also recognise that I'm potentially raising them a little bit. But
they
also,
might have inadvertently taken a horror book out of their emotional library that they've not had chance to read yet properly.
You must have been in debriefs where that's kind of happened as well, and you can see, and it is that, we don't have enough time for this now. And just thinking about what you said about follow-up emails, I think is a great idea.
Yeah. Because it gives something, and I do get people responding, and actually most, I would say, the people who've responded over the past 10 years will be saying, gosh, because I talk about a funnel of life and everything going in and how full your funnel can be sometimes, and again, relate that to my experience. And people will say, I've got this going on and this going on and this going on, and I sit there and read this email and think, wow, how brave are you sitting through this training session with me? And they inevitably end up saying something like, I had a good cry at the end, I feel so much better. And I think that's the interesting thing, that we are carrying these things anyway. And so within the session, being very aware of that as a facilitator, being very aware of that as the person who's leading the session is really vitally important, because it gives that psychologically safe environment, rather than in the middle of your workday when there's things going on and you're just going to get triggered at any point with absolutely no support, no follow-up, nothing, going, hopefully debriefing, but it's not always happening, is it? On a ward, for example. And so I think it's recognising all of that there are emotions that might get raised, but this is people's lives, and they're there, they're present. And I think being able to show as a facilitator some of your own vulnerability, which I do. Yeah. I show myself not showing empathy in certain situations. So they very much have the opportunity to take me off any kind of pedestal they might have put me on. Sure.
You lead with that. No, don't you? And that's I think one of the things that comes across in about how you talk about your training is that you lead very openly with your vulnerability. And I think that is one of the things that is kind of that draws people into what you're talking about. And
it's an asset, isn't it? Yeah. It's not a vulnerability, it's an asset. And so many of our learners see their vulnerabilities as something completely negative,
as deficits,
and they're not. And we do we do something similar, don't we? We suggest having a shared vulnerability with your learners, because it helps to flatten the hierarchy. And you'll never completely get there, but they'll see you as a human rather than an educator.
I think even in that, like, we're still being kind of quite mechanistic, and we're talking about the simulations.
It's tip of the iceberg, isn't it?
Yeah, it's tip of the iceberg, and it just makes me think about how many simulations have I ever run where there was genuinely kind of an emotional outcome as a result of a debrief? And I would say it's very few.
It happens, but
occasionally. Yeah. And I know that that's because most of the time we're driven towards meeting some kind of
metrics and goals,
technical learning outcome, or metrics and goals. But it as we're talking, it's just occurring to me that there is so much space, as long as there is time and the simulation is appropriately planned, but that there is a space in that debrief for being more empathetic.
So I'm just thinking in my head, as an educator, there are so many plates spinning and wobbling, time being a big factor.
Time.
And I'm wondering whether that empathy plate is the easiest to fall sometimes.
Yeah.
When you've got so much other stuff going on.
It is, because actually it's something, it's not something that's easily measurable, so it tends to fall off the list of priorities sometimes. We can't quantify it in quite the same way as other things. And genuinely, people will survive things if you've not empathized. They may be psychologically hurt or damaged. They may remember it for the rest of their lives. But we manage to cope with it. We may put barriers up and communicate less effectively ourselves because we've not received that kind of care and compassion in the past. But we tend to still survive. And so it's the thing that tends to drop. And once we are spinning all those plates, we simply have less capacity to do it. Neurologically, we can't do anything about that. We have less capacity. Our mirror neurons will function less well. And, our cognitive overload, it's not because we don't care or we've stopped caring. We simply do not have the emotional reserves to do it.
Sure.
So it tends to
and
drop
again,
off.
From a simulation point of view, we're very conscious of cognitive overload.
Yep.
And often we say it from a situational awareness point of view. So, and again, it's linked to not being able to complete practical tasks and technical proficiencies.
Yeah.
But the empathy is just as important, and I would assume handled very similarly in how the brain processes and deals with information when it's kind of stressed.
Yes,
Yeah.
and this is why, Carolyn, I want you to come and we want you to come and talk to simulation educators, because I think there is so much here that we could unpack further.
Carolyn, can you measure empathy?
You can, there are lots of different scales and tests that people can use. I kind of not doubt them, but I think that they're all reliant on people giving certain answers. So are they taking into account all the cognitive biases that we have, and where we are on a particular day? I could do a measurement on empathy on one day and score completely different on another day.
Yeah. The reason I ask is I'm thinking about a comment you made where you said you just genuinely, you get that gut feeling that someone's being genuine. And I'm wondering whether we can use a technique, which is advocacy with inquiry. So when we debrief with good judgment, to highlight those genuine moments of empathy. The simulation is really complex and difficult. It seemed to me that you were demonstrating genuine empathy. Just be interested to hear what your thoughts were at the time, and just rather than and acknowledge it more, even if we can't measure it, rather than just parking it or saying you said the right words.
If I've understood you correctly, a sort of a bit of research has come to mind where they actually, I can't remember the ins and outs of it. It was such a long time ago I read about this, but actually how people will utilize their empathy more and become better at it the more they believe that they have the capabilities and that they're good at it. And that is something that I try to bring into my training. I try to encourage people that they have these capabilities, that they have the ability to understand, to empathize. It's why I tell my story at the beginning, because I say you will have all just utilised your cognitive empathy. Chances are that's what you'll have all done. You will have all imagined, intellectually understood my experience. You may have felt some of my emotions. We may have even felt it in the room. It may have even felt tangible to us in the room, and you may have even been looking at what compassionate action you would have wanted to have taken. So I kind of try to encourage that their empathy that they may have felt in that situation is very real and very useful and very powerful, to try and really encourage that with them. Is that kind of where you're going?
And that's a perfect segue actually into talking about what you do. We've talked, and how you do it. So, empathy training is your business, right? And we'll put, for anyone that's interested, we'll put a link to Carolyn's website and contact details, if that's okay with you, Carolyn, below.
Of course.
And you've sort of outlined that you tend to begin that empathy training with expressing the vulnerabilities that you have and telling the story. But what does a day's training look like after that? So you kind of give that hugely powerful opening, and then you kind of give people that experience of genuine empathy. How do you harness that over the course of a training session?
So some is easier to show than others, and some also, there's a bit of an element of surprise in my training. So if I say too much and then somebody actually has my training, it kind of blows the cover a little bit.
Okay, that's fair enough.
So bear with me on that. I'll try and encapsulate it as best as I can. But I think there's an element when they've had that emotional experience first thing in the morning. And of course, I do a bit of sort of setting the scene first. I don't simply drop them straight in with that, but kind of set the scene as in recognising that behind every fact will always sit an emotional component. And then they start to go into my story. And there's some lightheartedness there and some humour there, because that's really important. And actually, that's part of who I am as well. So we need to have that for balance, that catching all the different emotions going on. But I think we also need to recognise some of the science behind it, what's going on in that brain of ours. We do fun work around perspectives with different illusions and how we see things differently from each other. So I have people standing up looking at images and all sorts of different things. And how are you seeing that? Because I'm seeing this. Yeah, same image, different things.
Yeah.
That's kind of how it works sometimes.
Right.
We're coming from an emotional place, a professional place, a personal place. Same event, completely different perspectives, but doing it in a fun way about how our emotions change very quickly. I even have Mr. Aidan Turner there because he's my personal lovely image because I love him, so he's in there and makes me smile. But it brings that human aspect that there'll be things that make us smile, make us laugh, and then if we're in that frame of mind, we're much more likely to maybe help somebody else if we're feeling good. If we're feeling in a bad place, we're much more likely to head down. Don't look at me. I don't want to engage. I'm in a bad mood. And all of that affects our perception, and that's where our empathy starts, how we're regarding something, how we're interpreting something, how we're understanding something. And that's just visual. You then got emotional understanding, systems and environments influencing us, all those different things, our cognitive understanding. And so we go through all of that. They then watch real case scenarios. I make a joke, actually, that I don't do role play, but I kind of tease them with it a little bit. And I know there's a huge role for a huge benefit with role play, but I also know that most people cringe when they hear the word. So I kind of tease them with it and then actually say that they're not doing any.
Right.
But they watch.
Just use the word simulation instead of essentially the same thing.
Absolutely. You can't get away with it in quite the same way as me.
No.
But that they're going to watch some real case scenarios, and within these real case scenarios, it really draws out some of their biases, some of their labels, some of their judgments, because they are you empathizing with this person who's shouting in a car park? And often they're not, but they might be empathizing with a person who's in a meeting with somebody, a professional, treating them and communicating in an unhelpful way with them. And then actually they find out they're the same person who they've not empathised with and they have empathised with. And so it brings in, actually, I have got empathy, I have got compassion, but there are really things that get in the way for me sometimes.
Sounds fascinating.
It is, isn't it? And it's so relatable. I'm thinking of so many parallels. I do human factors training and it's the same kind of thing. It affects all of us, but part of that training program is getting people to sort of have that light bulb moment, like, that happens to me. Oh, it works in that way.
Yeah.
It's fascinating. I love the library analogy, by the way. When you were saying that, I keep going back to it.
I've just put that in the educator's library, actually, the emotional library. That's an absolute gem.
Part of the challenge with empathy is your library's different to mine. So some of the books I don't have. And again, framing that perspective.
Yeah. And that doesn't make you any less able to empathise and be compassionate to somebody than me. It just makes your emotional library different to mine.
Some of my books are pretty tatty. So.
Well, some of mine are as well. But I will struggle. I'll struggle with some situations, and I'm sure you both probably experience the same. That the disadvantage of the more emotionally aware you get, the more you realise your flaws.
But it's like anything, isn't it?
Absolutely.
You're a human being at the end of the day. You're as vulnerable as anyone else and susceptible to make the mistakes that we all do when we're trying to avoid them. All we're doing is developing skills so that we're more aware about it. But with that awareness comes
we
all the baggage that comes with it.
Absolutely.
We talked about this on a previous episode of SimCast when we talked about the horsemen of the debrief apocalypse and the archetypes of simulation educators who derailed debrief. And the reason they were so easy to pick out is because we see ourselves in all of them. The person who wants to talk too much, the person who's too critical, the person who wants to tell stories. It's us. But it's just saying, like, this is just an archetype. And of course, we're all human, we're all fallible. We all get it wrong sometimes. But you tell us a bit about what you do. Who do you work with?
All sorts of different people and organisations. So a majority of my work is with healthcare providers. And that's really where the heart of it sits. It's where it kind of came from, if you like. So it actually started off to address the duty of candour and preventing prolonged psychological harm, and recognising within that it's harm that a service user has experienced or is likely to experience for a continuous period of at least 28 days, but within a complaint or an incident. That can be going on for days, for weeks, for months, or even years. And so that psychological harm can often be much more about the aftermath of an event and the communication that takes place rather than just the event itself. And that's kind of where the heart of it started out to address. But as it developed and as it evolved, and really embodied that human aspect of us, and whatever our role, job, gender, race, we're all human beings, and we will all experience similar elements, albeit wrapped up differently. And so it's now expanded. I've done work with coroners' officers, training program, with the MOJ, with housing associations, with councils, and it's of course tweaked for each audience, but there will be applicable things. And what I personally find very heartening when people do their evaluations, and I'm asking their takeaway points and things they do differently. There's a lot about them personally as well as professionally. So, need to recognise that we don't know what somebody's coming into our service carrying, and maybe I need to do a little bit more self-care. And that's a really important thing.
Particularly for healthcare professionals, I would imagine.
Absolutely.
Definitely.
And so that really, really supports, I think, the fact that it goes across the spectrum of human beings, whatever role they're doing. Even just personally, really, but of course, most of it is within a framework of either, PSERF or duty of candour or civility, restorative practice, things like that. So it tends to sort of have a framework around it, but that's only a very small part of it.
Talking of things that people take away from the sessions, I think we're probably getting towards a point where we might need to think about. We could probably
sit here and talk all day about this.
We could. So,
if people would like to contact you and to get into contact and maybe organise some training, how would they do that?
Best way is there's an email address on my website. You can go on my website. There's lots of information on there. There's also that you can access
podcast.
My podcast, even though I need to do an awful lot more, as we've talked about already. It's a new thing, folks. If you're listening and you go into that, and I'm not anywhere near as experienced and as what we've got here in this room. But yeah, there's that you can learn a little bit more about me. But there's also a lot of information of the courses that I do and the variations. Can set up a Teams call. We can have a chat. I always make sure that my approach is a fit for the organisation, because there may be empathy training that's needed that is less about vulnerability, less about that emotional experience, and more about just the words. That's not what I do. So I do make sure that I'm a fit for what the approach that somebody's
fantastic
looking for.
And so what we'll do is we'll put a link to your website with the episode as well, so that people can contact you if they want to.
And people can, my empathy navigation pathway, the infographic is a free resource on there. You don't have to have the training to have that. But what happens with the training is you understand the origins of it more. Yeah. It gives that lived experience with it for people to understand and to take it forward more. But it is meant for a simple here. If this is useful, utilise it.
Well, thank you.
Fantastic.
Thank you for sharing that. And I guess, there is so much more we could say, isn't there? And, I've got a note here to say, if there was one thing that you would say to enhance empathy, but I feel like almost by asking it would erode the complexity of what we've talked about. So I'm a bit torn now.
Yeah, I was going to ask a similar sort of thing. What sort of quick win could you? But it's not a quick win.
It's not about quick wins, is it?
It's not about a quick win, but actually, I think it is recognising our own well-being within it. I think if if we don't look after ourselves, one of my key quotes that I say at the end is, you can't give a hungry person food if your plate is empty.
Yeah.
And it kind of, I say at the end because it kind of really hits home with people. And I think that is really, really important to recognise your own needs. The more we do that, the more we do have to give to other people.
What a perfect way to finish.
Carolyn Cleveland, thank you so much for coming on SimCast.
Thank you.
And thank you for joining us. And we can't wait to see you in the next episode.